So what am I going to talk about this time? I think I wanted to spend some time, especially with this being Mental Health Awareness Month, about coronavirus and what I do in my daily life to kind of deal with my mental health, and how do I set a schedule, how do I cope. So there's been lots of research already looking at coronavirus and how this quarantine has been affecting a lot of individuals' mental health, whether it's people having social anxiety, developmentally for children, not being used to play, along with isolation of individuals leading to higher anxiety and depression. Some of the key things that I've tried to incorporate in my life is having a schedule. So the first thing I do every week, every Sunday, I look at my week and I incorporate things that I think are very important to maintain my mental health, and I think should be incorporated in your daily lives too. So the first thing is exercise. So I do yoga every morning, and then I do 20 minutes of something more intense in the evening, and that allows me to kind of get my mobility going. It increases my endorphins, and some of those like good things that go through my body and increase my metabolism, make me feel happier, as exercise has been shown to help with improving mood. And then in my schedule, I organize what am I going to eat this week, and so that I can maintain a healthy, balanced diet, and also because I have to plan my grocery store visits like once a week, like everybody else now, because you try to minimize the amount of going out to try to minimize like whatever it is, community spread of the virus if somebody else has it. Then I organize social visits. So although we are physically distancing, having that emotional connection with other individuals is so important. It's part of what makes us human. So I actually will, call my friends and have organized at least Wednesday, Friday. I have visits with FaceTiming my friends, and that allows us to keep in touch. And then I also do the same with my family. So I usually would go visit my mom and my dad on weekends, but because I can't do that twice a week, we FaceTime for an hour, and that allows us to stay connected as a family. And I also do this with my sisters as well. So that's kind of the social aspect. The last piece I think is important is my work. So, of course, I still have to come into work regularly in order to see some patients, but I also have a lot of home time, and in general I'm not working as much as I used to from an allergy perspective. So what I've done is I've allowed myself this time for reflection and thinking about what are my career goals, what are my what does my trajectory look like? What are things I can do right now at home in order to build that? So for me, it's been things like building up content for a website I'm going to create for allergy. Making YouTube videos for you guys, has been something I've always wanted to do to help people in general. And one of the classic memes of doctors that we want to help people. And for me, that's more than just, my patient and daily interaction. It's helping people on a more large scale, whether that's helping their mental health, helping them understand my career trajectory, decision making, and then moving forward, I'm hoping to give a lot more videos about whether it's allergy or how to keep organized, how to study, just some skills I've learned over the last 10 years of being in a pretty competitive and tough program. After I've kind of mapped out my goals in my career, that's something I break that down into small chunks, and I organize in my week on things I can do. Write an article this week, make a YouTube video this week, make a TikTok, mainly because it's a lot of fun. And so that's another thing I incorporate in my schedule. So, I hope that this little tidbit is allowing you to have an idea of what I'm going to do in a day. And now I'm going to actually take you with me, and you can see from 8 a.m. till nighttime. You get to follow me. So hope you enjoy. Good morning. It's my wake up time, usually around like 8:30. I'm definitely a night person. I'm not a huge fan of waking up early. So I usually wake up at 8 to 8:30. I have an alarm set, and now first things first, I check my Instagram and my TikTok, obviously, which I know is not necessarily the most healthy thing to do, but that's what I do. So that's the real deal. Oops, my hand was super in the way there. I wish I had someone to film this. it would be like way more cool and hip and whatever, but I don't. So this is what we get. And then after I do that, I don't know how to video myself watching TikTok because this is my iPhone, which is what I usually use. So imagine it. Then first things first, brushing my teeth. Okay, I'm getting in the bathroom. I don't know about you guys, but like for me, I'm the type of person that doesn't like to kiss or talk or even breathe in the morning without my teeth being brushed because I just like find it really gross. So that's why even making this video for y'all is kind of freaking me out a little bit. But the things you do for YouTube, once again, it's just me filming, so I wish I had a videographer or something, but I brush my teeth. I use one of those electric ones, and because I know you're supposed to brush like 20 seconds per side, etc., I actually have this really dandy thing that tells me, I don't know if you can see it here. Yes. It has like a timer and tells you how long you should be brushing your teeth, because if I don't need to think about it, that's what I like. So it's from Oral-B. And yeah, it basically tells you what to do. And then after I floss, because oral health is super important for not only your teeth and your gums and preventing gingivitis, but also cardiac health too. I don't know if you knew that, but it's true. So after I do that, I wash my face and then make coffee and then yoga. Here I come. So I like to start off my morning by doing yoga. I usually do 20 minutes of Peloton. I don't know if you guys have heard about it, but I used to bike it all the time and I got super addicted, and then I had these like huge thighs. So after the gym closed, I had to like use the app in different ways, and I love all of their different programs, and this is not an ad. It's genuine. So check it out. It inspired me to learn how to do a headstand. So I think for mental health, just having that time, 20 minutes in the morning to check in, it's been one of the pros of not having to commute as much. I'm able to kind of focus on my breathing, my flexibility, what kind of muscles are sore. Also, it's allowed me to practice my headstand, which I don't know why, but for me, it's been a goal to accomplish, and I'm like 75% there. Depends if I'm being spotted or not. And yeah, so basically that's what I do next. Hello, so this is me in my office. Most of my day I spend doing computer calls. As you can see here, I just have like my video call and conferencing, and then I type up my notes on my computer desktop, and then if I have to see patients, then I see them there. But most of the day I just spend on the phone and on the computer, just checking on patients. And obviously because I eat so much, everyone keeps asking about my cookies, but today I had celery, thank you very much. And then, okay fine, I had pizza for lunch. It's for my mental health. It's all about balance. I walk to work and back, so I feel like I deserve the pizza a little bit. And it's all about balance in life, as I just said. So I had celery as a snack, so I deserve pizza as my lunch. So that was my first meal of the day, because I intermittent fast, as I mentioned earlier. And now what's basically gonna happen is my patient's outside in the waiting room there. They get all their shots. If we need to do any of their allergy shots, we do it there. I had a kid that came earlier that had to do a challenge for peanut. So that means I give them a little bit of peanut every 15 minutes to make sure they don't react. So yeah, so that's my office day, and I'm in scrubs, and I wipe down, as you can see, the Clorox here, 19,000 times in a day. And then my patients sit 6 feet away from me as well. And when I see them, I'm wearing a mask and a face mask and gloves. So that's a little tidbit of my office life, and then I'll get to go home. So today I work only half day. As I mentioned earlier in my other video, how I balance out modeling and medicine is that I kind of do both, but I make sure I have time in my clinic where I'm not working so that my agency can schedule me in. So that's that. Now we go home. So I usually walk to work nowadays. I used to take the subway, but because there's just so many people, unpredictably, although I'm sure it's pretty much empty now. So it's about a half an hour walk, and I try to socially isolate. So then that's the end of my work day. Hey, I'm back from work. So I got home about an hour ago, which is around 5 o'clock p.m. Canadian time. And so basically after that, I usually come home, wash my hands, get the coronavirus off, wash my face, and then I exercise. So I do a HIIT class, which is about 20 minutes, and I think I talked about this before, where I use Peloton as the app, and I really love this, and it's not an ad or anything, but I just genuinely think they have really quick classes that just get your heart rate up, which is super important for your cardiovascular health. So that's what I do. Then I shower, and then I cook. So, a day in the life of a physician, it's super busy. A lot of times I don't have time to go grocery shopping, and I end up eating things that are not super healthy. So I've gotten into the habit of this thing called good food, and I don't know if this is anywhere else but in Canada, but the premise is that basically they deliver meals for me at the beginning of the week, and it's just the raw ingredients. So, if I'm gonna make like some type of salad, or if I'm gonna make a burger, then you'd have the meat and the onion and the tomato, and I'm drooling because I'm like thinking about dinner. But basically it's, you cut it up yourself and you kind of do everything yourself, but all the ingredients are there. And then when you make the meal, it tastes like pretty much amazing and you feel like a chef, but like secretly you're just using all their ingredients, but it's totally worth it. And I think this is awesome from a time saving perspective, and also, from a financial perspective, because when you're making dinner for one person, I don't know if you guys have the same problem, but I basically will buy like a huge head of lettuce, and then it's like I eat 2 pieces of it and then the rest of it goes bad. So this one, it's like portion control, and it makes me feel like I'm not putting anything to waste, which is awesome. And they take their boxes back, so it's like recycled, which is amazing. So that's basically what I'm about to do after I get off this. And I'm happy to one day make a video about how I cook my meals and from a nutrition perspective. After that, I usually will spend my me time. So as I mentioned in the first part of the video, I think it's important to lay out a calendar, a schedule of every day of what you're gonna do. So from my 7 to 8 p.m., it's me time, and it's my time to socially connect with the people that I love. And whether that's my family, my friends, my fiance, just making sure I have that time to connect with people, because you have to remember, although we are to physically isolate, we shouldn't actually socially isolate. So those connections with your friends and family and your loved ones is super important from a mental health perspective. And by scheduling that in, make that, take that initiative, like contact your friends, be like, so for me, every Saturday and Sunday from 2 to 4, I talk to my mom, and then I do my dad on Sunday, and then, I have my sisters scheduled throughout the week and some of my really close friends. And I think it's just really helped me maintain like that closeness with my friends. And to be honest, some of my friends I've gotten even closer with because I see them more frequently than I would have if I had dinner with them once a month. So I really, really highly encourage that, like, take that initiative. Don't remain socially isolated, because those are things that are linked to depression, anxiety, starting to feel like you're alone, and keeping those connections just really makes you feel better, to be honest. I just feel like, woo, have friends and family that love me. And if you are feeling really isolated and really alone, there are so many resources out there that are, especially during this time, where you can connect with different helplines. So please do that if that is something that you're feeling. And then when I'm done that, it's basically 8 o'clock, and then I watch TV, and I watch Grey's Anatomy. I don't know if this is a bad thing or a good thing, but whatever. It's something I love and I enjoy, so I do watch an episode. And for me, when I first started watching it, I was in undergrad, and I used to watch it to motivate me to go to med school. I'm like, I have to study super hard, or everyone motivates differently, and that was my way. And so now it's like, obviously I'm done school and done medicine. It's like, why do I watch it? Even my fiance's like, what are you doing? And personally, I like to catch the diagnosis before they say it. So I used to watch House, but I finished it, and then now I watch Grey's, and I'm like, I hear the different things that the doctors are saying. I'm like, oh my God, they have Kawasaki disease. And then after, Meredith will be like, Kawasaki disease, and I'm like, yeah, I got this. So anyways, that's why I do it, and it makes me happy. And then I usually go to bed really early. So around 9:30, I'm starting to wrap up. Usually I'll read a book for about half an hour. And there's a really great meditation app that sometimes we'll do before bed. I think it's called
Headspace, but I will confirm that and put it in the description because I'm not 100% sure. And basically you can listen to that for 10 minutes or 20 or whatever works for you, and just like ground yourself, make yourself meditate. It's like made me think about muscles and relaxing my toes and things I never even thought about relaxing before, but I actually really like it. It's helped me go to sleep super quickly. And I used to be a person that has problems going to bed, and sleep is super important for mental health too. So, I really hope that, this video has shown you the importance of different aspects of my life that I'm trying to encourage you guys to try and do to keep your mental health on point. So some of the things we talked about is, one, having a schedule throughout the week in order to schedule your exercise, eating healthy, social connections, also trying to think about things that you want to do to be productive, goals that you might have in your life right now. So laying these things out if you maybe have more time on your hands right now. And I think, the last thing for me is just taking that time to meditate, whether it's reflection or taking time to read a book, or that self-alone time has really been shown to help a lot. So I really hope that this video has been useful for you guys, and I'm hoping that maybe next I'll go through my nighttime routine, because once again, I'm probably way over 10 minutes. I don't want this to be like this long, drawn out thing that you guys have to listen to, because I know how that can be. Anyways, hope you enjoyed, and subscribe for more videos.